Please welcome Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, and Alexandra Sifferlin of Time magazine.
Thank you. So thank you, Dr. Tedros, for coming to talk to us about universal health coverage. When you became Director General just in July, you made universal health coverage one of your top priorities. First, can you tell us what that means to you?
Universal health coverage should be taken as a rights issue. Health is as a rights issue. That's very helpful because we cannot talk about universal health coverage. We cannot talk about universal health coverage without recognizing health as a rights issue, an end in itself. But in addition to that, health is a means to development too. So when I advocate for universal health coverage, that's where it starts from, health as a right. And then when you talk about universal health coverage, it means a health system that gives healthcare services to citizens with financial protection. I think that simple definition would be important instead of going into details. Health services with financial protection, because many families are getting into poverty because they're spending their savings for healthcare services. I will tell you one story. My own friend, he was diagnosed with cancer, and then he had to make a choice. He had to make a choice because after he was diagnosed, the amount of money they asked him for chemotherapy and the rest was a lot. If he used the saving of the family for treatment, he would use the whole money, so the family would be overnight impoverished. Then this man had to make a choice, either to use the family money to extend or live for some more years, or not to use the money, leave the money for the family, and die naturally. Do you know which one he chose? He chose to just go naturally, and he survived for 2 more years and left the money for his family. Why would we allow people to make that kind of difficult choices? Either to die or survive but impoverished with the whole family. This person was very courageous. But there are many families who just consume their saving and then they get or descend into impoverishment. So that's why universal health coverage is important. Access to health care with full financial protection. And I will ask you a question. How many of you can just go to health services seeking health care whenever you want to? Can you raise your hands? It's almost full house. Don't take it for granted. There are more than 400 million people worldwide who don't have this privilege. And access to health services should not be a privilege, should not be a luxury. People should not die because they're poor. Then I will tell you another story, my own story. This is when I was around 8 years old. And my brother, a younger brother, 5 years old, we were living under the same roof, even sharing a bed. He was ill, which we gather now was because of measles, and he died. I survived. It was just luck. We were in the same home, sharing everything, living the same life. One dies, one survives. Why do we allow that to happen when we have the means? Why is the world not really coming back to its senses when it has the means? Then I will tell you the positive side. How many of you know that Sri Lanka pays even for cancer treatment for its citizens? Is it because it's rich? Is it? It's not. It's because of political will. It's because it takes health as a rights issue. So I leave it up to you. The world has all the means and resources to do it. That's why we should advocate for universal health coverage. Thank you.
So universal health coverage is something that is debated in this country and elsewhere. Why is it important for the global community to really back this idea? What do countries gain?
I think countries can gain a lot. Number one, with universal health coverage, you can reduce poverty. Because I told you, families who just use money out of their pocket get into poverty. If the nation state helps them, they will not descend into poverty. So you can reduce poverty by implementing universal health coverage. Second, you can create jobs. By expanding the health services, you create more employment. And third, it's very important for economic growth. With universal health coverage, you have healthy society. That means the country will grow. So it has a dividend. That's why I said health as a rights issue, an end in itself, but at the same time, a means to development. And number four, it's a matter of equity. Universal health coverage means men, women, rich, poor, everybody will access the services. Number four, that's number four. And number five, you know how some epidemics are raging our world, wreaking havoc. We can prevent epidemics too through universal health coverage because we will have a strong health system that can prevent epidemics. You remember when the whole world was in panic when Ebola was attacking. You remember that. The whole world was in panic and fear. So universal health coverage and strong health systems can prevent that too. So these are the 5 benefits, among others, and that's why countries, leaders, should have the political will to commit to universal health coverage to make all these gains. It's a smart investment that each country should do because it's central to even achieving all the sustainable development goals we're talking about. It has a dividend. And unless we cannot really understand it, it's really clear. Or maybe deliberately don't want to take it. It's very clear. Thank you.
Absolutely. So some of these solutions that you just talked about require decision-making at the top levels of government. But what can people in this room do to help bring about the kind of change that you're calling for?
I think every individual matters. Every citizen or a member of this globe matters, its voice. And you can ask for that. We can turn this into a movement. For instance, there are 58 countries now globally who recognize health for all or universal health coverage in their constitution. So we can really have our voice heard so that the other countries can also follow suit. There are best practices globally that can be benchmarked and used by those who are not following the universal health coverage routes. And you're the voice to make this happen. And I ask you to start the movement right away, saying people or any individual should not die because they're poor. They shouldn't. And it's embarrassing to let them die when we have the means. So you can create your own hash movements, and you can talk to your respective governments to come back to your senses and to make this happen. And as you know, there is already a global commitment with Sustainable Development Goals, to leave no one behind. So we have to respect that commitment. We have to respect that commitment. And your voice matters on this. And health is central. Don't allow anybody to make a choice between death and poverty. I told you, the guy, my friend, which I told you to make a choice, he had to choose between dying or impoverishing his family. So he had to choose between two least bads, and he had to, between two bads, so he had to choose the least bad, meaning departing from this world, but at least leaving the money for his family. Instead of getting into sorrow and impoverishment with his family, he wanted at least to leave something behind. So please tell everybody that no one should make that kind of difficult choice when we have the means at hand. When we have the means at hand. So look forward to working with you very closely. I'm talking to the youth group and also other communities, civil society, grassroots, in order to work together to make this happen. And we have a goal to achieve, Agenda 2030. If we're committed and ready to do it, it's possible, because we have all the means at hand. Thank you.
Thank you. Thank you, Dr. Tedros, for sharing your vision, and enjoy the rest of the summit.
Thank you. Thank you very much.